Hello and welcome. In this lecture, we are going to talk about the different forms and formats that you might see when we are documenting. On this page, we're simply just outlining that the forms that you're going to see may vary from facility to facility depending on what the patient's needs actually are. For instance, is your patient population that in a nursing home, where it is their home and that we are focused on making sure that they're eating and drinking and having bowel movements, that they're bathing. So all of those, we'll have flow sheets for those for quick, easy access. In a hospital settings, we may also have some flow sheets for ins and outs and bowel movements, or perhaps not. And then a lot of times that we'll have flow sheets combined with actual complete narrative or head-to-toe types of assessments in order to get the full picture. Because according to College of Nurses, if you recall from our last lecture, nurses must document their assessments, so that can be in narration, it can also be on flow sheets, the interventions based on the problems that they have identified, and the client's response to the interventions. So using a combination of forms to help us to do that. Another philosophy is not to double document something. This way you're preventing slightly changing it when you document it in one spot to another spot. And then regardless of the system that's in place, especially if your employer has changed to a different type of documentation system, or if you have you are a new employee and their documentation system is a little bit different than at the last facility, it is your responsibility to make sure that you are getting sufficient training so that you feel competent to be able to document things accurately. Saying, I didn't know how to use that system isn't going to hold up well in court. From a legal perspective, if it wasn't charted, it wasn't done. Thus, all nursing care that is accomplished must be documented someplace, whether it be on a flow sheet or in a detailed, comprehensive head-to-toe assessment note. On this slide titled Types of Documents That May Be Found in a Client's Chart, I'll just let you kind of read through some of the different tab sections that you might find. What's listed here is mostly pertinent to a hospital client's chart. If you look in your nursing home client's chart, you'll have some of the same things, but not everything. In a clinic, you'll definitely have a history and physical upon the initial assessment, and then after that, it's just per visit updates and such. So again, I'll just let you read through of those. There are many different types of forms out there, and we're going to hit just some of the highlights, some of the more common types of forms that you might see. In either case, when you are working at a facility, you want to know whether or not the form that you are document on is permanent, in which case you have to follow all of the rules that we have just finished discussing, or if it's only a temporary worksheet, in which case it's just there to kind of help you organize, and at the end of the day, all of the information needs to be part of the permanent chart and it needs to be shredded. So the worksheet is the first one, and that's exactly it. It is just a temporary file. Sometimes they're as informal as just a blank piece of paper that you are jotting notes down as you're getting report, and then as you're looking to see what meds are due at what time, what treatments are done, what time that the physiotherapist is coming, what time that they're going down for x-ray, etc., so that you can have the patient where they need to be and at what time, and that they're getting all of their meds in a timely fashion. Sometimes it's more organized than that, and it's a printout, and that you're just filling in the details. So regardless, it's there just to help you organize your day. And at the end of the day, you're going to scan to make sure all of the little notations that you've put it on the sheet as you've been doing your assessments have made its way into the permanent chart, because before you leave the facility, you need to put it into the shredder box. You cannot take it home with you. There's a lot of confidential information. Remember PIPA. Look on your actual slides for the rest of the information underneath the Cardex. It seems to have gotten shortened on this app. Okay, so our Cardex is, sometimes it's permanent and sometimes it is a temporary type of tool, and it's just simply a communication tool that allows you to see at a quick glance what is the most current orders? So are they NPO? Are they diet as tolerated now that it's like 5 days post-op? Did they make them NPO because they're going down for another scan tomorrow? What's my most current IV? What's my most current IV rate? Etc., etc. What are the most recent labs that are still needed? So if the Cardex is to be used as a permanent document, you must use pen. However, most facilities will use it as a temporary form, in which case you are just erasing the previous documentation so that you're only seeing the most current. And again, you want to be careful and double check whatever orders before you carry them out in the actual orders, because sometimes people get busy and they forget to update the Cardex. So it's just a tool, it needs to be verified. I can't emphasize that enough. So this is a sample of the Cardex that the Health Alliance uses. You'll note that we've got the patient's diagnosis, their admission date, who we got the information from when we admitted them, how did they come in, was it through the emergency, was it direct through their family physician, etc. Why were they admitted to the hospital? Did they have any previous history or surgery? So again, all of the things that you can find in the regular chart, but they're kind of condensed, the most important things. Do they have any allergies? Do they have directives for CPR? IV therapy, what is the most recent? Are there any other treatments, such as wound care? What is the most recent? Were the diagnostic tests that were ordered and booked? And then on page 2, inside, we've got kind of a head-to-toe quick assessment as far as what was there on admission, and are there any orders that are pertaining to the respiratory system, the cardiovascular system, the neurological. So again, it's just a tool to give you a quick snapshot. You have to go back to the doctor's orders before you execute anything that you see in a Cardex. Another type of form that you might see are monitoring strips. So this one is a 12-lead EKG. Sometimes they're just on monitor, and it's a 3-lead EKG, and that if there's significant rhythms, you would tear off that strip to put it in. I've seen monitoring strips where you've got pregnant ladies, and that they have pictures of the contraction wave at the same time as the fetal heart rate and the baby's response. And so that at the end of the day, any of the significant data that is coming off, if they're going into their record, you want to make sure that it's labeled so that the patient's name is there. You can identify the their unique hospital identifier and the date and the time that it was obtained. Another type of form that you're going to see quite often is flow sheets. I haven't seen any facility that doesn't have some kind of flow sheet. And the sheet that you've seen for vitals, for routine bowel movements, intake and output, anything that is routine care is documented on a flow sheet. And so that at a quick glance, I can see my last week of bowel movements and no bowel movements. I can see my last week or 2 weeks of what my temperature has been running for this patient, or what their heart rate or their blood pressure has been running. So they're a really handy tool to see at a glance the pattern that is accumulating. They're really quick because you're either writing a check mark or just a quick little notation at the bottom, so you know who put the notation in. You use just your initials because they're just small little boxes. But when you use initials, there has to be either a mastered record of whose initials they are, what is your full name and your status, or at the bottom of the flow sheet, some facilities will have a box so you can match up the initials with the full name and title of the person. And when you have information on a flow sheet, you want to refer to the flow sheet data rather than to summarize it, rather than to replicate all of the information that's on there. Because one of our rules of College of Nurses is to avoid duplication of information wherever possible. In this app, the section on care plans was also shortened somehow, so go back to your original notes. The care plan is just that. It's outline, a summary outline that documents the care that is planned for this patient. It identifies the needs and the wishes of the client, and it helps to make the plan clear so that you can have continuity of care within the facility. Within the nursing home, they do a really good job of formulating care plans, and routinely, at least at a minimum of every 6 months. Sooner, if there's been status changes with the clients, they go through them to make sure that the goals and the needs are still current. Some facilities or units will utilize communication books as a means to alert staff of changes in policies and procedures, or if you've got long-term clients, perhaps there's been a change in who the power of attorney is for somebody, or something has changed. Shift reports tends to be if you've got one charge nurse reporting off to another charge nurse. And then anecdotal records, I haven't really come across those. But all of these different formats are simply as a tool to alert staff to critical information so that it's not missed, that it's passed on from one person to the other. If there is any client information contained within that, you need to make sure to maintain confidentiality by making sure that charting that book is kept in a confidential area and it's not discussed anywhere else. And at the end of the day, when it's served its usefulness, it is shredded appropriately. And if there is any relevant data about a client's condition, it also needs to be documented into the client's healthcare record. So again, these types of reports you might see, and it's just a means to make sure that everybody, all of the staff, is on the same page with this information. Another common type of report that you may see is a transfer report, and that's because facilities must maintain and hold their charts for a said length of time, and we talked about that in our last lecture. So when a client is not going home, they're going to another healthcare facility. That healthcare facility needs to have pertinent data as far as what happened at the initial facility and where are we going, what's the plan. So sometimes they are written and sometimes they are verbal, or a lot of times it's a little combination of both. And the SBAR format is format just means situation, background, assessment, recommendation, and this is an example of what you might say when using the SBAR format. So a lot of times the SBAR format is used at the Chatham-Kent Health Alliance when you go there. It just helps to ensure that the report that you're giving, whether it be from one nurse to the next nurse, or you're transferring between one unit to the next unit, or you're calling the physician, or you're calling a new facility, that you have organized yourself so that your data is comprehensive. So just to have a quick read through the SBAR little quickie sheet to help you familiarize it, and again you'll see a little bit more of this next semester when you're at the Healthcare Alliance. So that's it for this first part. We're going to continue, look for part 2 of our forms and formats.